Hey guys, welcome back to my channel. So today I'm going to be giving you guys a little pregnancy recap, and I'm also going to give you guys details about how things are currently going right now. This is my second pregnancy. My first pregnancy was about 2 years ago. My daughter was born in January 2020, and overall that was a good pregnancy. Like, I really don't have many complaints about it. The first trimester sucked. It always sucks. I hate the first trimester. I'm like lazy, I'm tired, like exhausted, tired, nauseous. I threw up a lot of that pregnancy. So yeah, I don't like that. But after that, like, I'm good. I'm a very good pregnant person. And I know a lot of people want to know, like, what's the difference between two pregnancies? Are they the same? Are they different? Especially when they're different genders. So this pregnancy, I am having a boy. So I was looking out like to see if there were differences. And for me, the boy pregnancy in the first trimester was easier. I still had nausea, but I never threw up, except for once when I was brushing my teeth. I don't know, I have like a weird thing with that. But not really any throwing up. And I was tired, but not to the level of exhaustion that I was when I was pregnant with my daughter, which was just insane. So this time around, I was tired. I don't know if it's that I wasn't as tired or if I just didn't have time to be tired because I'm chasing behind my toddler. But the exhaustion was still there regardless. So that was definitely a difference. It was, the first trimester was a little easier. And like overall, I might even say this pregnancy is just no, that's a lie. It's not easier overall. I have just different aches and pains. So anyway, with my daughter, my birth plan was to do all natural, unmedicated, in a birth center, like all that crunchy stuff. That was me. That's what I was doing. But it didn't end up going that way. And my water ended up breaking earlier than it was supposed to, and I wasn't having contractions, so I had to give birth in the hospital. But it was still unmedicated. I still followed my plan. It was just followed in the hospital. Unfortunately, I did end up with a C-section. It's not because I had like any serious complications. I think it more so had to do with the fact that I had a 9-pound, 2-ounce baby, and she wasn't in a good position. She was like in the worst position you can possibly be in. Which, by the way, I will be posting my video of my first birth, so like a birth vlog. I will be posting that later on though, so look out for that video. It's with your time. Yeah, so with that being said, this pregnancy, I still plan on doing an unmedicated natural labor. Why? I don't know. I'm crazy as hell because that is like the worst pain I've ever felt in my life, but it's doable. But I plan on doing unmedicated again, and I plan on having a VBAC, a vaginal birth after C-section. So if you're not familiar with that, it's basically just literally what it sounds like. Instead of having a repeat C-section, I want to try to do vaginal this time. So I found a doctor who is very well known for doing successful VBACs, and she has like a team of midwives. She's pretty much like the most natural approach doctor you can find in South Florida. So I've been going along with that, and I definitely plan on sharing my journey with how that goes. Y'all just wish me luck. So this pregnancy, I'm having my boy, which I'm very happy about because I got my perfect little pair. I can decide to stop here or keep going without no pressure and people saying, oh, are you gonna have a third? All that, like, I'm good. I'm good, honey. So with both pregnancies, I found out really early, like before my missed period. I think I know my body very well. Honestly, I probably sound crazy, but like I know I felt implantation. I could feel like a little pinch on one side when it happens. But since after having my daughter, I actually feel ovulation. I never felt it before, but now I get cramps around ovulation time. So I kind of know like, oh, we probably, hit the mark. But this time I did find out pretty early, maybe like 3 or 4 days before I missed period. I had a little faint line, but a faint line is a real line, and that means you're pregnant. And of course it kept getting darker, on and on. So that's how it was, like no crazy big surprise. I just straight up told Lamar I'm pregnant, and that was that. I told you guys about the first trimester. So it was pretty much the same symptoms where I'm tired, nauseous, really unmotivated. And that part was hard with a toddler. Second trimester, breeze, my favorite trimester. You're not too big, symptoms are not too bad. And then here I am, third trimester. So I'm currently 32 weeks pregnant. I'm in the third trimester, and yeah, now I'm starting to feel it. Like I still feel good. I think I carry pregnancy pretty well, but the symptoms, like you just, they're there. So I feel crazy movement. He moves so much. I think he moves more than Leia was moving. Just feel him all the time, like he's fighting in there. I don't know what's going on. So I feel him moving a lot, and I started feeling movement at like 17 weeks pregnancy with both. The movements obviously like changes now. It's really strong. You can see it. But I did start noticing around 17 weeks. As far as like what I deal with symptom wise, I'm pretty good, but I have started to get shortness of breath sometimes. And like I have to accommodate that. So now when I'm in the kitchen for a long time and I'm cooking, a lot of times I'll pull up a chair and to wash the dishes, because the standing for a long time is just a lot. My back starts to hurt and my hip starts to hurt, which is another thing that I've been dealing with. So the lower back pain has started maybe in the past 2 or 3 weeks, and that's just like your regular back pain from carrying weight in the front. But I've also been dealing with this other issue, which began after my first pregnancy, but before this one. So this pregnancy wasn't the cause of the pain, but anyway, it's a pain in my hip and like my right butt cheek area. And it was, before I got pregnant, it was like debilitating. I cried thinking I was gonna be like handicapped. It was really, really bad. I had the pain combined with sciatica. If you have sciatica, you know how bad that can be. The pain that I have, I think it's a combination of like tendonitis and hip instability. That's a result of my both pregnancies. But I've since been going to physical therapy, and I've continued to go to physical therapy, so it is manageable now. But as I get bigger, the weight pulls forward and adds strain on it. So I like live with it constantly on a daily basis, but it's bearable, and physical therapy has helped. So I'm hoping after I deliver, I can like get rid of it totally. But yeah, so also with the like breathing, I also have this weird thing where in the mornings I get kind of lightheaded, and I think I have to pick my breakfast wisely or something. I don't know. I'm still trying to figure out how to avoid it. I had this with my last pregnancy, and at that time I was working as a nurse, and after eating breakfast, sometimes I literally have to like go lay down in a empty patient room or something to try to feel better. I don't know what that's about. But my blood pressure runs really low, so it could be that. Like I was in the, like I would be like 80s over 50s, but now I'm doing better. It's like hundreds over high 60s. So it's evening out now. So stretch marks, lovely stretch marks. I do have stretch marks, but they're old. So my first pregnancy, my belly like looked good the whole time. I made my own little, it was my first pregnancy, I'm going all out. I made my own little like buttercream sauce for my belly, homemade on the stove, and I would rub it on every single day. I was good. Those last like 2 to 3 weeks hit, and I got stretch marks around my belly button. So I'll actually show you guys. Okay, it's really not that bad, but I don't want to get too close to the camera because y'all just might be seeing too much. But this is kind of like an awkward position. I don't know if you can see it. It kind of depends on like what angle I'm at, where you can see like some angles it's silvery, some angles it's just, I don't even know. But yeah, that is how my belly looks. And my, linea negra is trying to come. It's not as dark. It's not as dark as it was with Leia. And y'all, I got a nail appointment in like 30 minutes. Don't talk about me. Okay, so that's it with stretch marks. This time around though, I haven't gained any new ones, but that little end, the last couple weeks though, I'll definitely be looking out. I don't know what more you can do other than rub oils, moisturize, and I know staying hydrated is really important because you have to internally hydrate your body. You can't just rub creams and think it's gonna cut it. I personally use these two. I use bio oil, which is pretty popular, and Weleda Skin Food Ultra Rich Cream. I rub both on together. I just wanted a combination of oil and lotion type of cream. So I rub both on every day. So far so good. We'll see how it holds up. I have started to feel Braxton Hicks contractions, and I know people are always like, well, what does that feel like? For me, it just feels like it's not painful at all. It's just like a tightening, and then I don't know, it's tightening and it's almost like I lose my breath a little bit, and it's just it slowly happens. It feels also as if the baby is like trying to push out. I don't know, it's the best way I can describe it, but it's not painful. It's just like a weird feeling, a tightening feeling that lasts for a short period of time. And that started a few weeks ago. So I'm 32 weeks now, maybe that started like 28, 29 weeks, along with muscle cramps when I'm sleeping. It's only when I'm sleeping for some reason, but like, in the middle of the night, sometimes you'll stretch your legs out. And when I do that, if I do it too long, or if I point my toes while doing it, I'll get a cramp in my calf. And the other day, it was like a legit Charlie horse. I had to get out of bed and try to stretch it out. And then when I woke up, it was sore. But yeah, I try to stay hydrated and think that hopefully that will help too. And when I stretch, I just flex my feet instead of pointing it, and that helps also. Another thing is I have this super ugly varicose vein. I don't know if you can see it. I gotta like lift my leg. It's so awkward. But it's right here. I'll probably try to like take a different video of it, but the varicose vein comes from the pressure of the baby on the vein, and I guess that vein is weak, so it's having backflow, and varicose veins tend to be hereditary. So if your mom don't got it, you might just be all right. I don't know. But that's my only one. It popped up in my first pregnancy. It went away after I delivered, and then now it came back this time, but earlier. So I'm just hoping that last month that it doesn't just, I don't know, start crying at me. I have been feeling hiccups, which is just like a little rhythmic, like you just feel a jump like every second. I think those are like my main symptoms. I don't have any swelling yet, but I'm sure it's gonna come because it came last time. I sleep just fine. Like I pee a lot in the day, but I still maybe only get up once at night. So that's not much of an issue. I don't really have any cravings or aversions. I lied. I don't really have any aversions, but cravings, the last like month, it's the ice. I love the ice. Chick-fil-A ice. If you know, you know. Chick-fil-A ice is what I've been drinking. I mean, Chick-fil-A ice is what I've been eating. I'll go to Chick-fil-A and walk in and ask for a cup of ice, like plain. I can't go to the drive-thru and ask for a cup of ice. That's legit, like, embarrassing. But yeah, and then I've been drinking a lot of milk, like real milk. So I normally drink like almond milk or something, but I've been wanting cow's milk, cereal. I like eating like chocolate bars with milk. I just love me some milk. So now that I'm 32 weeks pregnant, I've been going every 2 weeks. When you get to 36 weeks, then I'll start going to the doctor weekly. 36 weeks, I will find out the weight of this baby. Please, I'm hoping that he is not gonna be as big as Leia and put me through all of that. So I'll be finding out soon, and I'll do another update, and I'll share with you guys how big he is and how everything is going. So, just follow along with me, and if you liked this video, make sure to like, comment, and subscribe to see more. So thank you guys so much for watching, and I'll see you guys next week.